Good morning, Community Action. My name is Denise Harlow. I'm CEO of the National Community Action Partnership, and today we are here to celebrate the 40th anniversary of LIHEAP. The Low Income Heating and Energy Assistance Program has been around for 40 years, helping to help families over crises in their own lives in terms of flow of cash coming into households, but more importantly, keeping the lights on, keeping the heat on in the winter, keeping the cooling coming in the summer. And this program is just such a critical element of keeping families stable. So thank you to Community Action for your work in this program. And I'm excited today to be joined by two leaders from the administration who have been focused on energy assistance and helping families be safe, stable, and secure, especially during this time of the pandemic. So first, I am joined by Debra Johnson, the Deputy Assistant Secretary for External Affairs for the Administration for Children and Families over at HHS. We are so excited to have you with us. Ms. Johnson, thank you so much. And we are also joined by a very familiar face, Lauren Christopher, the Director of the Division of Energy Assistance over the Office of Community Services. And we've known Lauren a long time. We know her dedication and passion for energy assistance and specifically LIHEAP, which is a critical tool in our toolbox for helping families. So Debra, I'm going to turn to you first. This 40th anniversary really is a moment in time that we want to recognize. Can you talk a bit about both kind of bit of that 40-year history, but also about how it helps families both in national crises moments like we are sitting here in COVID, but also in terms of their own individual family crisis? How would you like to start us off today?
Well, one, I'd like to start with happy 40th anniversary for LIHEAP. All of the staff within the Administration for Children and Families whom have worked diligently to get funds to families that are in need, to you, Denise, and your organization who partner with ACF in ensuring that families have access to the programs, funding, and services that they need as well. So this is a momentous celebration for families and for the Administration for Children and Families at the same time. And a little bit of background, as a block grant, LIHEAP was perfectly positioned to pivot in real time at the beginning of the COVID pandemic. The beauty of the block grant structure is that the federal rules are written very broadly and expect that each state, tribe, and territory will design their LIHEAP differently in order to meet the unique needs of their communities. After all, heating and cooling needs do not look the same in all parts of our country. So our agency released guidance to the states, tribes, and territories beginning in March 2020 and has continued through today to brainstorm with these entities on how they can continue to adjust their programs, maintain operations, and serve as many households as possible. With the additional funding through the CARES Act in 2020 and the American Rescue Plan Act this year, LIHEAP allotted more than $10 billion over the past 2 years to help individuals and families with keeping their home heating and cooling services on. And growing up on the south side of Chicago, as a former recipient, as a kid in a household of low-income single mother, I know personally that LIHEAP impacts the lives of families. I want to give a heartfelt thank you and acknowledge all of the LIHEAP grantees and sub-grantees, LIHEAP program director, fiscal managers, intake workers, and other staff truly rose to the challenge to keep their programs operational throughout the pandemic. We heard about and continue to hear about the amazing efforts that community action agencies, local governments and states, tribes, and territories took to accept applications virtually, as well as other physical distance in-person application options for their applicants, some who lacked computers or cell phones to do this virtually. As we know, our low-income families come in a diverse perspective, as I mentioned earlier. Given the increase in resources we currently have through CARES Act funding and the American Rescue Plan, it is especially important that collectively we work hard to reach individuals and families who are not aware of LIHEAP. We know that there's sometimes a stigma on accepting low-income assistance funding, but this is a need as we are in a pandemic, and families may find themselves needing additional resources because of the impact of the economic downturn by the pandemic. LIHEAP is a lifeline and it is here to help Americans stay healthy in their homes. And we have to ensure it is reaching those who are most in need.
Thank you, Debra, and your passion for this work. I appreciate that you shared a bit of your own personal story and the value that these programs and services provide to families and children every day. So I so appreciate you sharing that. And thank you for your work and leadership on the national level. You're exactly right. During this time, so many folks have needed kind of that bridge, right? And there's been a lot of money flowing through the system. But that's because it's needed, it's necessary, and is being put to use every day. So thank you. Lauren, something that Debra mentioned about kind of being in the first kind of point of contact. You know that community action agencies and other providers, right? But so certainly we're focused on community action agencies here, and so many of our agencies either are one of the key LIHEAP kind of bridge for families. It's often an entry point, right? People come in because they're in crisis. But we also know community action can then provide a myriad of services, as can ACF, right? There's a portfolio of programs and services that truly help families be sustained over time. Maybe you could talk a little bit, we're certainly focused on a two-gen or whole family approach. We look to serve the family. And if you come in for services and you need to make sure that your power bill gets paid, let's make sure you get stable, because you need to have those immediate needs met. Can you talk a little bit about how you see energy assistance and utility assistance play a key role in that? We talk two-gen or we talk whole family approach. Maybe you could talk a little bit about that.
I'd be happy to, Denise, and thank you so much for having us on your.
Could you speak up a little bit? You sound faint.
Oh, sure. Can you hear me better now? Okay.
Much. Thank you.
Well, thank you, Denise, for having us today to talk about these important issues. And I do want to thank CAP and you in particular for your leadership on two-gen in particular. I know this is going back quite a few years that really we've been trying to work on this. And the two-generation approach does really look at the whole family and how each individual's well-being depends on the well-being of the family overall. And this approach is something that our office has worked on for a number of years in partnership with CAP, particularly from the Community Services Block Grant Program, CSBG, right, where the community action agencies really, have that support from our office in particular. But that's not something I need to tell this network. All of you are familiar with that. Many of you are right on those front lines working face-to-face or now virtually face-to-face with the people in need. And the community action agencies, as you say, are that main entry point for those individuals and families seeking to apply for several of the programs that our agency, the Administration for Children and Families, oversees, which includes CSBG, LIHEAP, and even Head Start. And so for LIHEAP, the states, the tribes, and territories that are the LIHEAP grantees, they're permitted to use up to 5% of their LIHEAP grant each year towards something we call Assurance 16, which comes from the LIHEAP statute. But basically it's for supportive services for the household that can include, but are not limited to, household education, coaching about how to use their home heating and cooling services in a safe and healthy way, household budgeting, and other related issues. And so we really, really encourage our LIHEAP grantees and sub-grantees to, particularly the intake workers, to use that holistic case management approach for each household. And that way we can try to minimize the time it takes a household to take off from work and from family care in order to apply for the benefits that they need. In many cases, providing assistance with just one bill or one need is really insufficient. In many ways, it's just a Band-Aid. And so when we take a holistic approach to serving families, we help them access as many of the benefits that they can qualify for, hopefully in that one visit or as few visits as possible. And so we are able to provide really what we call wraparound services that really help promote self-sufficiency, helping them get to a place where it's not just which bill am I going to be the most late with. So this really is really trying to make sure that all of the household's basic needs are met, but also going beyond that to help them actually see and realize a path where they're just not juggling those bills from one moment or one paycheck to the next. The other thing I would say is that for over a decade, we have observed in LIHEAP that more and more grandparents are raising grandchildren. And given this trend, it is incredibly important that our LIHEAP network prioritize outreach and application that are being received from grandparent-led households, because they really combine two of the most vulnerable populations that the LIHEAP is trying to assist: seniors and young children, because they really feel much more quickly and much more significantly the negative health effects from very small changes in indoor temperature or outdoor temperature for that matter. And those individuals may also be on medication or need medical equipment that requires reliable, continuous home energy. So we know that the Federal Centers for Disease Protection and Control, CDC, estimates that on average of more than 700 heat-related deaths occurred each year between 2004 and 2018 in the United States. And CDC also found that natural heat exposure served as a contributing cause of death related to certain chronic medical conditions, as well as alcohol poisoning and drug overdoses. So this is why it's so absolutely critical that we identify ways to target these households. And for 40 years, the goal of LIHEAP has been to reduce the stress and burden of heating and cooling costs for low-income households and to save lives by keeping our most vulnerable community members from becoming ill in their own homes, especially when they're disconnected from those services, or even if they just don't turn the thermostat on because they're worried they can't afford to pay the bill later on. So as we celebrate LIHEAP's 40th anniversary today, I'm just so excited that the impact of LIHEAP is strong, and it's going to continue to be strong in the years to come.
I'm so glad you raised some of those CDC numbers are striking, right? They're a bit jarring. And, you know, we oftentimes when we think about LIHEAP and or weatherization, when we'll talk about weatherization in a moment, we think oftentimes about very cold environments and you're trying to keep the heat in. But we also understand that heat kills, right? And those cooling elements and the need to keep cooling and fans and things like that and air conditioning, as well as when we talk weatherization about ensuring a home can have airflow and keep a family cool, has real health. It matters. Heat kills. So LIHEAP is a critical element of helping a household navigate that. So thank you for raising the health perspective. And also thank you for raising the Community Services Block Grant. CSBG is also celebrating its 40th anniversary today. And I know later today, David Bradley is hosting a webinar celebrating that as well. Because CSBG, LIHEAP, and you mentioned Head Start too, right? It's that whole bundle of services that can really assist families. Debra, as we think about the Biden-Harris administration's priorities, we know that equity is a critical element of the administration's priorities. It's a critical element of Community Action's history, mission, and values as a network. Our network is also in every corner of America. We touch 99% of America's counties through Community Action. And LIHEAP reaches, again, all those corners. Can you talk a bit about how LIHEAP and its work has really an element of the equity approach of this administration? Could you talk also a little bit about rural and urban, suburban, and even frontier, right? It really talks about the diversity of our country. What would you like to offer our audience here today?
Well, thank you, Denise. One, I'm so proud to be a part of an administration that has prioritized equity, and you see it in the demonstration of how the Biden-Harris administration is putting diversity within its hiring, within its communication, within its priorities. As an administration, you see it in every facet of the way that this administration operates. And it's a part of the foundational work that NCAP is doing, prioritizing and embedding equity throughout throughout the grantees and application process, and how we do and deliver human services to our children and families. And the Biden-Harris made it clear on day one, on the inauguration day, equity was a foundational priority for this administration. It included LIHEAP in its cluster of programs that are being tracked under an initiative that our Office of Community Service calls Justice 40, where 40% of program dollars are spent to support lower income communities. And that includes our rural, our urban, and all types of communities that are impacted not only by the pandemic, but any type of economic downturn. So our lower income families and communities. We know that our lower income communities shoulder the highest home energy burdens, which we define as the proportion of their income that is spent on their heating and cooling services. And all of us would agree. I think that keeping one's home at a healthy temperature is an essential necessity. It's not a luxury, right? We have witnessed deaths and coming from Washington State, knowing that lots of homes do not have central air or air conditioning. There has been, during these unprecedented heat waves that have come across the country, some of our state, tribal, and territory communities have been severely impacted by wildfires, floods, and other natural disasters, forcing many families to relocate. So again, as we collectively think about ways to help these families and ensure equity across programs, it is important to note that LIHEAP has a requirement that grantees conduct outreach activities designed to assure that eligible households, especially households with elderly individuals, disabled individuals, young children, and households with high home energy burdens are made aware of the assistance under this program. It is critical that grantees facilitate outreach efforts in an intentional and strategic way that increases access, availability, and services to LIHEAP.
You said Justice 40, and what was that? I want to make sure we have that framing correct.
Yes, our Office of Community Service, this initiative is Justice 40, where 40% of funding has to be allocated to our lower income communities.
That's fantastic. That's about intentionality, right? You have to be intentional if you're going to break down those structural barriers that are systemic in our system, right? We have to really dismantle a system that has incredible disparities built into the sauce in a lot of ways. And with that intentionality, you can refocus, repurpose, and move the needle, we hope, on those investments. So we look forward to hearing more about Justice 40 and whatever we can do to be helpful in that space. Please let us know. Lauren, as we kind of wrap up here today, a key element of LIHEAP is the investment that it comes with long-term energy burden decreases. Debra was exactly right. You talk about that energy burden, the percentage of a household income that goes to pay for energy expenses or housing expenses. And it's one thing to get a payment here or a payment there, or even some arrears being paid here during COVID, but we want those savings long term. And if we're going to work toward a country that can really have housing stock that is efficient and effective and can address climate change, right? We can even make that tie. We want housing stock that is built in a way that is efficient. Weatherization is a key element of long-term energy efficiency. Could you talk a little bit about LIHEAP's role in weatherization and helping decrease long-term energy burden and helping our country save and conserve energy resources?
You're spot on, Denise, and I'm so glad you've raised this important issue. I mean, we know that climate change and poverty are deeply.
Can you come closer to the microphone? Sorry.
Yeah, sorry. I'm just saying that climate change and poverty, we know, are deeply intertwined.
Yep.
And low-income individuals and communities are disproportionately exposed to environmental hazards and pollution, which have far-reaching consequences on the health and well-being of low-income households. And these environmental inequities are often exacerbated by climate change, making low-income individuals and families exceptionally vulnerable to the ill effects of climate change. And we know that low-income communities are less likely to have the resources to both prepare for as well as recover from extreme climate events like we've been seeing this year in particular. LIHEAP is one of the programs that the Office of Community Services administers, which can help low-income communities offset those negative impacts of climate change. And this can be achieved, as you say, through investments in weatherizing homes so that they are more energy efficient, and that helps make the home energy bills more affordable in the long run. Really helping to get to that self-sufficiency point. We know that the population that we target for LIHEAP benefits is the same population that typically is most negatively impacted by the effects of climate change and the related home energy insecurity, which is the inability of the household to afford its heating and cooling costs in order to stay safe and healthy at home, especially during those extreme weather events. So LIHEAP funding actually accounts for the majority of federal funding spent on weatherizing homes for people with lower income. And a lot of the weatherization measures don't cost the program very much money, such as improving caulking or insulation so that there's less heat and cooling air, cool air that is lost unintentionally. And LIHEAP can be used to invest in the highest heating and cooling bills, to invest in renewable energy sources for households with low income. And especially given that we are targeting those households with the highest home energy burden, which is those that have the highest heating and cooling bills compared to their income. So access to renewable energy sources allows households to be less dependent on and subject to the price spikes and transportation problems that we see with other heating and cooling energy sources, including deliverable fuels such as propane and fuel oil. My apologies, my toddler is sharing the room with me. We believe all households should have access to these cleaner sources of energy. And we really are committed to leveraging LIHEAP to ensure that low-income people and communities of color have access to those resources. And so today we celebrate the work that this network has been doing collectively to support weatherization needs over the last several decades. Really, the federal support for energy assistance really began and was grounded in weatherization and crisis assistance back in the 70s. So we are happy to be building on that and look forward to the future of LIHEAP and its role in helping the nation reach some of those commitments to carbon reduction by investing in weatherization and renewable energy opportunities. We are so incredibly proud of the work that has been done so far, and we're excited to see what comes.
Oh. Thank you, Lauren. We too are excited to see what comes. There is a lot of work to do, but we have learned a lot in these past 40 years, but also in these past 18 months. The human services delivery system can't look like it did 5 years ago, right? Our focus and intentionality on ensuring that families live in housing stock that is energy efficient. We understand climate change. We understand that weatherization helps, as well as LIHEAP itself, and keeping heating and cooling consistent goes to the health of families. We understand the social determinants of health much differently today than we did 20 years ago, as does the health community, right? We are all focused on keeping families safe and healthy. And when we can start with the basic needs, we can help set up families for success. So thank you, Debra. Thank you, Lauren, for your leadership. We so appreciate everything that the Administration for Children and Families is doing to help support families and children across America. Thank you to Community Action. We appreciate everything you're doing to bring these programs and services directly into the hands of families. So thank you for being with us here today. Take a moment today and just send some good vibes out into the universe for LIHEAP on its 40th anniversary. And we look for a very healthy and safe future going forward. So thank you, everybody. We'll talk to you soon. Bye-bye.